Hello, parents, and welcome to our virtual pediatric campfire chat, brought to you by Crystal Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your Crystal Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Well, good evening, everyone. Welcome to our weekly campsite chat. I see we have some familiar faces and attendees back, so thanks for joining us again. I'm Dr. John Nasser. I have two of my colleagues with us today at Camp Crystal Run. As you know, I'm at Camp Crystal Run in Middletown. I want to introduce Dr. Remenar first, and I'll let Dr. Remenar introduce herself. And I've asked the doctors, like usual, to share with us after introducing themselves what they've been doing during this shelter at home time. And as we've started to even open up a little bit to share that with you guys. So take it away, Lynn.
Hi, I'm Dr. Remenar, as Dr. Nasser said. I am also located at Camp Middletown Crystal Run, and where we have lots of fun. I've been there for the last 11 years, but moved from the DC area and have been a pediatrician for 20 years. So it's been my privilege to take care of a lot of children in the community. And I love being at our camp. So I'm looking forward to this conversation. I think there's going to be a lot that we can discuss and hopefully help with in terms of what I've been doing. So although we like to give advice, this has been quite challenging for my family as well as myself. So I have always thought I need to get some time away for myself and do some things to kind of help with my own mental health. And so during this time period, I've actually joined a few programs, apps. One is called Headspace, and the other one is 10% Happier, where I've been doing quite a bit of meditation. So that's hopefully kept me a little bit more grounded and being present for both my family as well as for my patients.
Great. No, thank you, Lynn. I look forward to asking some more about that as we get into the discussion today. And also from Camp Crystal Run, Rockland, we have Dr. Aimée Kahn. And Aimée, why don't you introduce yourself as well?
Sure. So I'm Dr. Kahn. I'm in the West Nyack location. I've been there just about 4 years, starting August. We have a great group down there, lots of fun there as well. I'm also very excited to talk about, mental health today. I think it's something that weighs on everyone's mind, and, we have a lot of parents that have a lot of questions about it. For the last couple months, we've been doing a lot more activities at home. I have a toddler that is 3.5, so we made a big point to celebrate a half birthday, which we had never done prior to a pandemic, but any celebration was a good celebration. We did tie-dye, as you can see, as I'm wearing today, which was a lot of fun. So we have tie-dye Fridays where we wear it around the house. So just lots of activities has been keeping us busy here.
Great. So actually, I had read something at one point, Dr. Kahn, about using things you have at home to make tie-dyes. So did you make your own dyes, or were you able to acquire some?
No, I was able, so I'm kind of a tie-dye connoisseur. I've been doing it ever since the first time I learned how to do it, which was actually in med school. And I picked it up. We've actually done it in the office a couple times with the staff and made, a tie-dye day where we all wore it around the office. And I've done it in the neighborhood with a couple of our neighbors. So kind of I haven't made any dyes on my own, but I'm able to pick some up, and we always somehow have it on hand in the house.
Awesome, great. So, well, thank you both and welcome. And for the folks that have joined us today, I usually like to just kick off the call with our show with just a brief overview of where we are here with COVID in the Hudson Valley before getting into the topic. And I think today's topic will be quite relevant, kind of given where we are. So as everyone knows, and I mentioned this, I think last week, the first case in New York State of COVID was on March 1st. And the first case of community spread was a few days later on March 3rd. It's now been 4 months since we had our first case at Crystal Run in the office. And in the Hudson Valley, across the regions where we have our practice in Rockland, Sullivan, and Orange counties, we have continued, thankfully, to be on the other side of a significant surge that happened through March and most of April. Fortunately, despite what we have been seeing and hearing going on around the rest of the country, the number of cases here locally has remained low. We've remained at a sort of a positive testing rate of 1% or less. And this past week, the Mid-Hudson region moved into phase 4 of reopening. I think all of us are concerned about a recurrence given what's going on. And I think everyone is probably aware that New York State has taken a step of requiring visitors from certain states to go under a sort of a home quarantine period when they return or visit New York. I think the reason we've gotten to this point, though, is through the hard work of many of our patients and parents and frankly, our families in terms of being careful about exposures and kind of going through this period of sheltering at home. And that period, I think, which has somewhat come to an end locally, or at least opened up a little bit, has brought with it exhaustion, fatigue, and some symptoms of depression and anxiety, frankly, that we've certainly been concerned about, and frankly, all of us and in our kids and patients. So to start off things, I just figured I would start with Dr. Kahn. Dr. Kahn, I don't know if you can just share with folks that have joined us today, what are some of the behaviors and symptoms of depression and anxiety that you've been seeing in your patients and that you've been hearing about from some of the parents that you've been working with during this time?
Sure. So any kind of stress in children, as in with adults, it can present itself in different ways, and there can be some very subtle findings. Obviously, changes in children's behavior is an obvious one, things like regression. So a fully trained, potty trained child who is now having bedwetting episodes or, having accidents more frequently throughout the day. We've also had parents come in and show concern, their child was never having any kind of stranger anxiety, and now the things are kind of opening up and they're able to see other people. They're very worried and showing signs of, nervousness when they're around other groups of people. Other changes that you can kind of notice when you're at home with your children, things like changes in their sleep habits. So, the summertime is here, and that tends to be a time where we may not be on our normal routines of going to bed at normal sleep and wake time hours. So going to bed much later, especially in our teenage population, and waking up much later. But if, they're sleeping a lot more as far as the total amount of hours of sleep, or even sleeping a lot less, or having multiple awakenings throughout the night, that's something to kind of be aware of and pay attention to, that something else might be going on.
And how prevalent has this been? Are you seeing this in a lot of children? Is it once in a while? Give us a sense about, how frequent these things have been during the, the last few months.
So I would say, more than 50% of parents come in with a concern about some type of behavior change, whether it's, some kind of normal behavior change that's just more exaggerated during these times, more acting out, more not, listening because maybe they're not in that school environment where they're used to the constant, refocusing that they're getting with their classmates and things like that. And the children that are, there's been a variation in what we're seeing with how they were getting education through March and June, depending on what schools they were going to. So some children, were getting a lot of online Zoom classes, and other children were getting sent emails on how to just do work and weren't getting as much FaceTime. So I think a lot of that also affects the number of kids that we were seeing with any kind of concern.
Okay, great. Dr. Remenar, I'm sure you've had a similar experience in terms of the patients that you've been seeing. What are some of the things that that you've been sharing with families in terms of like how to manage through some of these behaviors that that Dr. Kahn mentioned?
So I think a big point of what Dr. Kahn was talking about is really what's disrupting the routine of what kids are used to. So in so much as the time that they wake up, the activities that they normally do, when they eat, anything that's disrupting that is coming out as a disruption of their stability. So I think the importance of routine is so important. I would love to share a personal kind of story with that. So my teenage son has a rare kidney disorder, and we realized even as a pediatrician that routine is so important. And we kind of lost a little bit about that when he was sick and in the hospital a lot. he actually, we have always been, okay, we're going to keep the routine, keep him stable, but he had been in and out of the hospital so much that one day when the nurse came in and said, oh, we're going to draw the blood, he said to my husband, Dad, can I just wait? And at that time he was 8 years old, and my husband said he had been through a lot and said, can you just come back? And my son got very, very quiet, and about 5 minutes later burst out in tears and said, Dad, I'm going to die, aren't I? And my husband's like, no, why do you think that? And he said, you would never not let me get blood work. Like, this must be really serious. So I think I share that story because it was really impactful to me to the point where even though you think you're doing better for your children, like, oh, I feel bad for them, this COVID situation is really difficult for them, I think I'm going to, let them stay up a little bit later. I'm going to let them have a little bit more screen time. In their minds, even though they say, wow, this is great, I think it does rock the stability of what they feel like is really keeps them really grounded. And they may feel like, oh, maybe mom and dad are more worried than we think. They normally would make us go to bed, but now they're letting us stay up forever. So I think that, you're actually doing a good thing by keeping the routine and making them feel stable. So I think that's a big part of what you want to do to have them maintain their good mental health.
Yeah, thank you for sharing that story. I think it's kind of interesting to think about, why are you being so nice to me? And we may not be thinking about that as parents. Dr. Kahn, along those lines, what are you hearing about and what would you recommend for families in terms of talking to their kids about what is a scary time for all of us? There are people locally that have gotten very sick, and many families may know someone or have had a relative who has died from COVID. How can parents talk to their kids about COVID and what that means, and also about staying safe so that they're being informative to their kids in a way that can be helpful?
Sure. So I really do think it is important to address what's going on, and obviously you have to do that at an age appropriate level. For my daughter, who's 3.5, we talk about germs. She has a hard time saying coronavirus. So she says, when can I go out when the germies are all gone? Because we used to have a routine of every Sunday, we would all go food shopping and then grab a bite to eat and then come home. So she's aware that that's no longer, as Lynn was mentioning, our routine. Like, she's picked up on there's, changes in what's going on. So with her, we discuss, the importance of washing hands and staying socially distant. And at that age level, even for toddlers, they can kind of grasp it, that there needs to be some space, and the importance of us having, some space between our friends and our neighbors. And instead of going, for instance, walks with our neighbors, we're waving to them from the road when we're on our walks, while they're in their driveways, and things like that. And I would, for older kids, you can kind of explain things a little bit more in depth and talk about, what the virus does and how it can affect you, and the importance of why we are doing all of this, especially for older teenagers. They can grasp more of the importance of why, it really is important that we're not all together in closed spaces, and we're giving ourselves time to not overload the hospitals and things like that. And I'm surprised at how much even the younger kids really do pick up on. Like, I really agree with what Lynn was saying, that routines are important, and it is important every day to check in, with your kids and ask them how they're doing and how they're handling things, and have them verbalize what they're feeling about being at home more frequently than they've been in the past.
No, great, thanks. I have a patient of mine. Maybe I'll ask Dr. Remenar what she would give as advice for this. But a parent came in, and they have I think he's a 12-year-old who at baseline has some anxiety symptoms, but now has developed severe fear of going outside and worry about being around others, and almost to the point that as they've wanted to get outside a little bit more over the last month, it's been very difficult for them. So how do you talk to families, and how do you help them with children who may be exhibiting significant fears related to some of the things that have been going on?
So I think that it's important to be honest with our kids, so not to lighten their fears, and to acknowledge their fears, and to acknowledge the fears that you may have. So as parents, I think that we can be truthful in what we think, but then giving the control back to the kids. So knowing that you may be exposed to COVID, but it's okay because you have the control of washing your hands. So if it's on your hands and you don't touch your face. So again, giving them the control back, I think will alleviate a lot of the anxiety, because I think that there's this feeling that if I stay isolated and I never get exposed to COVID, I'll be fine. But I think, the honest truth is that we at some point will probably be exposed to COVID, but because you're exposed does not mean you're going to be ill from it, does not mean you're going to get sick. It's not going to be the neighbor that unfortunately has passed away from this. If you're taking the precautions that you need to take precautions for, I think that puts a lot of control back into the kids' hands.
Great. And a lot of this is about, I guess, the things that you guys have been talking about are symptoms of fear and anxiety. When does it become like really concerning anxiety that a parent should, call their pediatrician? When do they actually, not so much about managing routines and behavior, but what would be like the threshold that you would recommend to a parent? You know what, it's actually time to call us. Because I think you might actually need some more significant intervention than just working on behavior modification.
So your point, John, with your one patient, the family's now feeling more comfortable to go out and trying to get fresh air, because we are balancing between, again, the physical fear of getting ill and physically ill versus the mental health of things, and we really do need the mental health component of it, and realizing that letting kids know that it is a balance. So getting that exercise and going outside and spending some time will actually help your body fight something if you actually get exposed to it. So it is a balance between that. But with a child who's isolating themselves and not being able to do the things that their family feels comfortable with, really not being able to overcome and act in kind of a more, like, the family has obviously come to notice that he's just not interacting at all, and that in itself can create lots of issues. So again, when you will have fears, but when it's taking over kind of your ability to interact with people and do routine things, I think that is a huge flag.
Okay. Yeah, Dr. Kahn, anything you want to add to that?
No, I totally agree. When you're starting to notice any of the symptoms or signs that are changes in their behavior and it's prohibiting them from doing things that they previously enjoyed or would be happy to participate in, I think that's a big red flag and a time that you should definitely be getting in touch with your pediatrician for sure.
Okay, great. Now this is a shameless plug, so I'm going to just ask, and I know one of you will answer. What if the child doesn't want to leave the house to come to see you in the office? What are some ways that we can interact with those families that maybe it is so severe that their child doesn't want to leave the house?
So I'm sure we both have been in this situation actually a few times, but we are obviously doing telehealth in the office, which has been a really great addition to treat our mental health concerned patients. It's an easy way for them to stay in their comfortable environment when they're home, with their parent. We can do our use our screening tools on them, even though they're not in the office, and ask them the necessary questions we need to kind of evaluate where they stand with all of this. So telehealth has been a really great addition to the practice and being able to assess and treat these patients.
Great. And I actually, Dr. Kahn and Dr. Remenar have been two of our champions of promoting telehealth in the practice. So for those at home, Dr. Kahn got the right answer I was looking for on that.
Well, I don't mean to make a shameless plug either, yeah. But, not even for mental health, but how many toddlers I've actually gone to telehealth and they're dancing and smiling and saying hi rather than the screams. I can actually see them interacting because they're in their natural environment. So I don't need to go over that hump. It's really nice to be examining them in their own environment. So it's, I think, really an advantage, and not having to wake them up to nap time to get them in a time that doesn't work well. So, there's a lot of conveniences to being able to see children through telehealth.
Yeah, and I think most practices are doing telehealth now, if not all. And one of the things that we've identified, I think, at Crystal Run, is that these types of experiences or these types of visits around behavior and anxiety, depression, worry, lend themselves very well to telehealth and will likely remain that way for a long time. We're prepared to provide care in this way, even after things hopefully at some point are settling down in terms of concern. One of the other symptoms, we talked about fear and anxiety, but one of the other symptoms, unfortunately, that I think a lot of people are feeling is anger. So I'm going to ask a question for one of my children. So I have a teenager, and I think, although not overtly, angry, I think is angry because, she has friends who are being allowed to do more socializing than she would like, or that we've been comfortable with. So maybe we'll start this one with Dr. Kahn this time. How do you help families navigate this issue of like what they can let their kids do? And in particular in the teens, where I think it is really challenging to not have the socialization, where maybe one family has taken this a little bit differently than maybe some parents are comfortable with, and they're getting some angry teenagers who are just exhausted through this shelter at home. How can you, what advice would you have for those kinds of issues?
Sure. So this really and truly comes up every day in the office, and we have a lot of parents that are trying to navigate what they're comfortable doing, and they're looking for guidance from us to figure out, is it acceptable for my kid to play with my neighbor but not with other neighbors, or is it acceptable for them to go on a walk but stay on the other side of the street? And as we're slowly allowing, some camps are opening and small group gatherings are being accepted in the community, I think it is important to remind parents, as we touched on before, to be honest with your children about why you're doing this and the importance of their health and maybe the health of other people, if you have immunocompromised people in the home, and how you're trying to protect them as well. But also letting them know, what you're comfortable with, and that it's not forever. This is not a permanent change, and trying to also not figure out a way to get them to be able to see friends, whether it's more Zooms or, people can come to your driveway and do things on that matter. We had a group of kids in our neighborhood who are teenagers, and they all parked their cars 10 feet apart actually, and opened up their trunks of their car, and then everyone sat in their car so that they could just see each other. Because I think, as you're mentioning, they're missing that social aspect of being with other people.
Yeah, I think this has come up on a few of our meetings, and it's probably worth just reiterating here. I'll throw this one to Dr. Remenar. What things are low risk? What are high risk as far as socializing during the current state we have here in the Hudson Valley?
Sure. So, of course, in terms of lower risk, the least amount of people gathered at one point. So, in terms of when you're with friends, maybe you would feel comfortable with one friend versus another friend, but a bigger gathering of teenagers would be concerning. Depending on the different sports. So I know some camps are getting together with different sports camps. It depends on the different sports, which I know we've covered in previous talks as well, that there are certain sports that are less risk factors versus higher risk factors if there's contact sports. Some of these travel teams, if you're actually gathering from other parts of the country where these travel teams are actually coming together from different areas, you could potentially have more risk factors there. So I'm not sure if I'm covering what you're exactly talking about, but we've talked about also playgrounds and situations where we're not so quite sure once a child has touched a playground equipment, how long the virus kind of sits there. So, and being comfortable about how in playgrounds or in parks, and I'm not sure if that's what you're talking about, or if there were other issues that you wanted to.
No, I think in general, we've been talking about sort of low risk outdoors, socially distanced. Coming indoors becomes higher risk. The more people in one place, as you mentioned, Lynn, higher risk. indoors without a mask on with a lot of people, highest risk. And I think, it's sort of always, and I know some families have been trying to sort of, the term we've been hearing is expand their bubble. So having one or two other families that they feel comfortable seeing indoors because they know that those families have been careful and safe. And I think the other thing that's come up on the past calls that we've had is just keeping in mind that the safety of all of these things is dependent on the number of cases locally, because that is also related to the risk. And again, we've been closely watching the scenario locally, and so far we're still in a good position, but it is something that also I think we would encourage parents to keep an eye on. We did get a question that I just wanted to ask you guys. I'm not 100% sure what type, but the question was regarding telehealth, that this parent likes telehealth, but is there an option for in-office care in the event that they would feel more comfortable coming in person and speaking directly with the provider? Now, the parent mentioned specifically therapy, so I wasn't sure if they were talking about a therapist. Maybe they can just submit another question about that. But what are the options if someone would prefer to come into the office? Let's start just with the pediatrician. Is that an option? And is there any sort of deterrent to coming in the office to see us?
So it's definitely an option, and I think we have done a lot of things to create a very safe environment for our patients. We have a no wait room policy right now, so we are having people check in from their cars, so that they're just coming up and going directly into a room, so that we can keep no areas full of a lot of people. And we're happy to see patients in the office, especially if that's what they would prefer.
So I feel like that definitely we can have patients come in safely. And this goes back to the point of talking to parents about giving their child the control. So, I realize that you're feeling a little anxious, or you might have a question you might want to ask Dr. Remenar or Dr. Kahn in person. Would you rather go into the office? I know that it's really safe, and what would you prefer? And, it's not one or the other. You can try telehealth at first, and if it doesn't seem like it's working well, then certainly it can be, you can decide to come into the office, or vice versa. If a child comes in and they don't feel comfortable, we can always next visit or follow up with a telehealth visit. So I think it's nice to have a hybrid. I do feel really comfortable that we're safe in our offices to see children, but I think definitely go back to your child and ask them what they would rather do.
Yeah, so the follow-up question, so just for the viewer who submitted this, we'll have to get back to, because the question was actually specifically about seeing one of the therapists at Crystal Run that they've been seeing, and whether they could come and see them in the office. And we don't have any restrictions on seeing people in the office, but I know that some of the therapists have been mostly doing telehealth from the office. But I'll follow up specifically with that therapist, and we can reach out to the parent and let them know about that. But at Crystal Run, we have no providers who are not doing office visits. It really has just become a blend of kind of what our patients have been wanting to see us for. So by the way, for those on the call at home, if you have questions, feel free to submit them through the Q&A, and we'll be happy to answer them live. So maybe at this point, I'll go to Dr. Remenar first. So Lynn, for families that want more information about managing through some behavior challenges during COVID, what resources do you recommend for them, and where can they go to find more information?
Sure. So obviously, like we talked about before, we're always available. So if your child has a good relationship with their pediatrician, we're happy to talk with them and see them. I did do a particular there were a lot of resources that I found that are available. One that it puts it in a non-threatening way for children between 8 to 15 is a website called Ask Sherelle. It's actually based with a therapist asking questions, but it's under the guise of a talking dog. So children submit their question anonymously, and on the other side of it is actually a therapist. And it was something that I vetted out and felt really comfortable with. if it's something that you want to actually integrate with your child, I found there was a really wonderful article that had all these resources for mindfulness. And so putting the child in present and being aware of how they feel. There were resources from as young as 4 years old to up to the teenage years. And, you know, I wrote all these resources, and if parents want to go onto our social media blog on Crystal Run, I think it was April 27th that there's links to all these different resources. So those are all great places to go and start and look at. But I think participating in whatever your child wants to do to kind of get good mental health is a good way to feel engaged with them and understand them.
Great. And Dr. Kahn, any other resources that you wanted to add to that?
Sure. So the CDC obviously has a good website, and if you look up mental health resources for COVID and children, like those 4 kind of words, it will bring you to their webpage, and that they also have a list of different resources that you can look at there. They even have a cute little cartoon that you can show certain kids to kind of explain what's going on and go over what the virus is. I also like Healthychildren.org. I reference that website quite a bit with a lot of my patients because it has a lot of useful information on there as well.
Okay, great. So in closing, so thank you both, a lot of information here. And I would also reiterate that if parents have specific questions about their children, you know, ask your pediatrician, reach out to us. We're available in a variety of ways. I think it's also worth just mentioning to all of us that this is a difficult time. It's okay to not be perfectly managing your children. We have not had a good routine system set up in our house. We have a lot of screens going on. Many of you have been home working and trying to balance your kids during this time, both when they were at school and now even more so now. And so I think it is worth acknowledging to all of you that, you know, you've made it 4 months. It's worth pausing and celebrating that fact and acknowledging how hard all of this is. And certainly, at least in my situation, and I think I speak for all of us as pediatricians, you know, we're trying to do the same stuff, and it's certainly easy to tell families what to do. It's not so easy always to parent that. But I think you know, it's important for all of us to give ourselves a break as we kind of move through this difficult time. But so in closing, I just wanted to let, we'll start with Dr. Kahn. Thank you again for being on today, and I think this has been really useful. Just in closing, if you could just share with our listeners, what is your best advice for resilience and maintaining wellness for families and for yourself during this challenging time?
So I think it's important to, as a parent or as parents, to understand that we're all going through this together. This is a global pandemic. It's new. It's not something any of us have ever experienced before, and it's difficult. You know, what you feel comfortable as a parent may not be what your friend or your colleague or your neighbor feels comfortable with. And that's okay, because you want to do what you feel is best for your child. And I think, you know, trying to figure out as things change, I think it's a fluid situation. So 1 week you may not want to leave the house, and then the next week you're comfortable going food shopping. I think it's going to change over time. So you don't necessarily have to feel that you're going to feel the same way forever, and just understand that it's okay to be nervous and to have some concerns about what's going on.
Great. And Dr. Remenar.
So I think that this has been a very difficult time, and as Dr. Kahn said, being fluid is so important. So, you know, when we started off, it seemed so cool to be going on virtual vacations and, you know, seeing all these things through the screen. And now my kids don't want to go on virtual vacations. They want to go on a real vacation. So realizing the challenge of that. But I would say that the best way to kind of get through things, in all honesty, is to have some sense of gratitude. We do know of many people who have had family members or close and loved ones pass away from this and be really ill from this. And so if, you know, if anything where you seem overwhelmed and you know, your kid seems angry, I think one of the best things you can do is just feel gratitude that if you're able to spend time with your family, if you're able to hug them and know that you're healthy and that this is a temporary thing and that we will get through this. So if I can say anything, is to live through this time through gratitude from whichever means that you can, is how I'm and our family is getting through this right now.
Yeah, that's great, Lynn. Thanks for sharing that. By the way, I meant to come back to, what were those 2 apps again that you recommended at the beginning?
Oh, so it's Ask Sherelle is one of them. Actually, I'll pull these out. So ASKSHIRELLE. And the other one is mindfulness technique. So it's basically through positivepsychology.com, and it's for mindfulness for children in their activities. So their actual activities that they can do. And then you had talked about families working with working from home. Washington Post put a nice article about techniques to help with homeschool, working at home, and coronavirus. So that is also something that the families can hit the link on when they go on that blog. And the other thing that I put on there, which we do realize, is that the practical things of resources, you know, a lot of these families that we're working with may not have the financial means right now or the support there. And so there is a link there to help locally. You can just put a zip code, and there's food banks there, places where they can get housing and shelter, and just kind of support groups there. So we realize that just the practicalness that, you know, we don't want to neglect and realize that families are suffering financially too. So, you know, as much as we want to be grateful, we also realize that people need help with that.
Great. And Lynn, you had also mentioned some apps for us as adults. So I think Headspace,
right,
and 10 Minutes Happier.
10% happier.
10% happier. Sorry,
Right.
I want 10 minutes. So yes, those are 2. I've been a fan of Headspace for a long time, and I haven't used the other, but 10% happier. But great, those are really nice resources for parents as well.
Absolutely.
Well, it's getting late. This is a great time of year. It's light out for a long time. I hope everyone goes outside and takes advantage of that, socially distanced. I haven't seen whether it's going to rain, but here at the camp, the fish are biting, so we're going to go. And I want to thank Dr. Remenar and Dr. Kahn again for joining. Just for those on the call, we have one scheduled call like this next week. It's a little bit of a totally different topic. It's on sports with Dr. Conway, who's one of our sports medicine physicians. We're going to talk about a safe return to sports, both in terms of injury prevention and then also how to get our children back in whatever sports competition is available to them, and to do that thoughtfully and safely. So I hope to see you next week. Again, thank you, Dr. Kahn and Dr. Remenar, and also thank you for everyone for joining us. Have a great
Thanks, John.
night.
Hope you get a big fish.
I hope so too.